Welcome, and thank you for being here today. I'm going to spend a few minutes walking you through some important information about Medicare Advantage plans. After this video, your sales representative will review plan benefits, answer any of your questions, and can help you enroll in the Medicare Advantage plan of your choice. To help you follow along, you have been given the Clarity Workbook, filled with important information about Medicare and Medicare Advantage plans. Throughout the Clarity Workbook, you'll see a series of checkboxes highlighting important information that United Healthcare and the Centers for Medicare and Medicaid Services, CMS, want to make sure you understand before leaving this meeting. We'll check each box as we cover these topics. Let's get started. Page 2 of the Clarity Workbook is about Medicare basics, beginning with eligibility. You're eligible for Original Medicare, which includes Parts A and B, if you're at least 65 years old, or if you're under 65 and qualify on the basis of a disability or another special situation. You must also be a U.S. citizen or legal resident who's lived in the U.S. for at least 5 consecutive years. There are specific times that you can enroll in a Medicare Advantage plan or Part D plan. The first one is called your initial enrollment period, and it lasts for 7 months when you're turning 65 or otherwise become eligible for Medicare. Your initial enrollment period includes your 65th birthday month, plus the 3 months before and the 3 months after. Each year, there is an annual enrollment period, which runs from October 15 to December 7. During this time, you can add, drop, or switch your Medicare coverage. If you're already a Medicare Advantage plan member, there is a Medicare Advantage open enrollment period, which runs from January 1st to March 31st. This period gives you a one-time opportunity to disenroll from your current Medicare Advantage plan and enroll in a different Medicare Advantage plan or return to Original Medicare. In certain circumstances, you may be able to enroll in a Medicare plan outside of the initial enrollment or annual enrollment timeframe. Some ways you may qualify for a special enrollment period are if you retire and lose your employer coverage, move out of your current plan's service area, receive assistance from the state, have been diagnosed with certain qualifying disabilities or chronic health conditions, or qualify for extra help because of financial reasons. If this seems like a lot of details, don't worry. It's all in your Clarity Workbook, which is yours to keep. Now, let's look at page 3 and talk about the different choices you have when choosing your Medicare coverage. No matter what kind of coverage you eventually choose, the first step is to enroll in Original Medicare. Original Medicare includes 2 parts, Part A, hospital, and Part B, doctor, and covers some but not all of your hospital and medical expenses. Original Medicare does not include prescription drug coverage. Once you've enrolled, the next step is to think about your individual needs and decide if you like more coverage than Original Medicare. If so, one option is to add a Medicare Supplement Insurance Plan, which helps pay some of the costs not covered by Original Medicare. You can also add a standalone Part D plan, which provides prescription drug coverage. Another option is to choose a Medicare Advantage plan, which is called Medicare Part C. Medicare Advantage plans are sold by private insurance companies and include Medicare Part A and Medicare Part B, just like Original Medicare. These plans may also include additional benefits not included with Original Medicare, such as prescription drug coverage, annual physicals and screenings, worldwide emergency care, and out-of-pocket spending limits, all in one single plan. Last year, there were more than 21 million Americans enrolled in Medicare Advantage plans, and 90% said they were satisfied with their plans. 87% of members said they were satisfied with the preventive care they received from their Medicare Advantage plan. Plus, when compared with people enrolled in Original Medicare, Medicare Advantage plan members experienced fewer hospitalizations, shorter hospital stays, and spent less money on their own health care. On page 6 of the workbook, you'll find information about Medicare Advantage plans for those with special needs. These plans include dual eligible plans for those with both Medicare and Medicaid, chronic condition plans for those with certain ongoing medical conditions, such as diabetes or cardiovascular disorder, and institutional plans for those living in a nursing home. Talk to your sales representative if you'd like more information about special needs plans. These plans may not be available in all markets. Now that you have a basic understanding of Medicare Advantage plans, here are 10 important things to keep in mind. This information is on page 7 of your Clarity Workbook. 1. You must continue to pay for your Medicare Part B premium. Medicare then gives your premium to your Medicare Advantage plan to help pay for your additional coverage. 2. Joining a Medicare Advantage plan could affect your current coverage. If you have existing coverage or employer-provided health insurance and plan to work past 65, check to see how joining a Medicare Advantage plan could affect the coverage you have now. 3. It's best to use network providers. Using providers outside of the network may cost you more. However, in an emergency, you can use any provider. 4. You may qualify for financial assistance. Depending on your financial situation, you may qualify for help paying your plan premiums or Part D medications. This is known as extra help. 5. If you enroll in Part D late, you may pay a penalty. If you go without Part D coverage for longer than 63 days in a row after your initial enrollment period, an additional amount may be added to your Part D premium. Medicare Advantage plans that include Part D coverage meet Medicare coverage requirements. 6. A Medicare Supplement Insurance Plan, Medigap policy, is not a Medicare Advantage plan. Medicare Supplement Insurance Plans are health insurance policies that are secondary to Original Medicare. Medicare Advantage plans combine Original Medicare, Parts A and B, and sometimes Part D, into a single plan. 7. Keep your member ID card handy. Medicare Advantage members must present their member ID card, not their Original Medicare card, when receiving services. 8. Medicare Advantage plans offer the same protections as Original Medicare. Even though Medicare Advantage plans are privately administered, you have the same rights and protections as you would with Original Medicare. 9. Medicare Advantage has you covered. By law, Medicare Advantage plans must cover all the services that Original Medicare covers and may offer additional benefits. It's important to know that hospice care is still covered under Original Medicare. And if you have TRICARE for Life or VA coverage, you could get more benefits. And finally, number 10, you have a built-in financial safety net. Unlike Original Medicare, your plan's annual out-of-pocket maximum gives you a safety net. This assures you'll never pay more than a certain out-of-pocket amount in a plan year for covered medical services. Now let's switch gears a little bit and talk about prescription drug coverage. This information can be found on page 8. Prescription drug coverage is an important factor for many people when choosing a Medicare plan. First, let's take a moment to clarify some terms. Your total drug cost is the combined amount you pay or others pay on your behalf and the plan pays for prescription drugs, starting January 1st of each year. This amount does not include premiums. Out-of-pocket costs are the amount you pay or others pay on your behalf, including the deductible for prescription drugs starting January 1st of each year. The out-of-pocket costs also include the discount paid by the drug manufacturers while in the donut hole. Again, this does not include premiums. These terms will be helpful in understanding the Medicare drug payment stages. Most prescription drug plans have 4 payment stages. First is the annual deductible stage. During this stage, you pay for your prescription drugs until you reach your deductible amount. If your plan does not have a deductible, your coverage starts with the first prescription you fill. Next is the initial coverage stage. During this stage, you pay a copay or coinsurance and your plan pays the rest. In 2019, you stay in this stage until your total drug costs reach $3,820. Once you reach this amount, you enter the coverage gap stage, sometimes referred to as the donut hole. In 2019, you will need to pay 25% of the cost for brand name drugs and 37% of the costs for generic drugs. You stay in the coverage gap stage until your total out-of-pocket costs reach $5,100. Finally, there's a catastrophic coverage stage. After you reach $5,100 in total out-of-pocket costs, you will pay only a small copay or coinsurance amount for the rest of the plan year. United Healthcare has a pharmacy network that includes more than 65,000 network pharmacies across the country. To receive benefits, you must use an in-network pharmacy and show your United Healthcare member ID card. You may receive additional discounts on your prescriptions by using a preferred retail pharmacy or by using the mail service pharmacy and having your medications delivered to your mailbox. A drug list, also referred to as a formulary, is the list of the drugs that a plan covers. Each plan has its own drug list. Before you enroll, be sure your drugs are covered. Many plans use a tiered formulary to group covered drugs according to cost. Typically, Tier 1 includes preferred generic drugs, Tier 2 includes generic drugs, Tier 3 includes preferred brand name drugs, Tier 4 includes non-preferred drugs, and Tier 5 includes specialty drugs. Step therapy is an approach many plans use to help you save money on your prescriptions by offering lower-cost drugs that can treat the same medical conditions as your current brand name drugs. You may be asked to try one or more of these lower-cost drugs before a plan will cover the brand name drugs you're currently taking. Some drugs have quantity limits, where the plan will cover only a certain amount of a drug for one copay or over a certain amount of days. The limits may be in place to ensure the safe and effective use of the drug. If your doctor prescribes more or thinks the limit is not right for your situation, you and your doctor can ask the plan to cover the additional quantity. Before a plan will cover certain drugs, it may need more information from your doctor to make sure the drug is being used correctly for a medical condition covered by Medicare. This is called prior authorization. In some cases, you may be required to try a different drug before the plan will cover the prescribed drug. If you need a drug that is not currently covered by your plan, you may ask for an exception. When you ask the plan to cover your drug, even if it's not on the drug list, this is called a formulary exception. When you ask the plan to waive coverage restrictions or limits on your drug, this is called a utilization exception. If your doctor has submitted an exception request on your behalf, generally the plan will make a coverage decision within 72 hours. You can request a faster decision if you or your doctor believes your health requires it. Your sales representative will be able to answer any additional questions you have about prescription drug benefits. We've talked a lot about specific details, but when you choose a Medicare Advantage plan from United Healthcare, you get benefits beyond expectations. You'll find more choice and more guidance. United Healthcare offers a broad range of Medicare products and can help guide you through finding the right plan. Customer service that puts you first. With compassionate customer service advocates ready to answer your questions, schedule your appointments, and help you manage your health. A healthcare company you can rely on. United Healthcare is trusted by 1 in 5 Medicare beneficiaries with their coverage. And we've been serving people just like you for more than 40 years, so you know we'll be here when you need us. The only Medicare plans that carry the AARP name. United Healthcare has an exclusive relationship with AARP to offer Medicare plans with the AARP name. We're aligned in believing Medicare beneficiaries should have access to affordable, quality healthcare. Finally, every day is an opportunity to renew. When you choose the Medicare Advantage plan from United Healthcare, you have access to our health and wellness experience, Renew by United Healthcare. Renew includes inspiring lifestyle tips, learning activities, videos, recipes, interactive health tools, and more, all designed to help you live your best life at no additional cost to you. In a few minutes, your local United Healthcare sales representative will walk you through the Medicare Advantage Enrollment Guide, reviewing key information, including the benefit highlights, which is an overview of the plan's most common benefits. The summary of benefits, providing a summary of the health and drug services the plan covers. The drug list, which is a list of drugs covered under the plan and their tier level. Enrollment information. Star ratings. Important plan information, outlining how your plan works, including additional programs and services it offers beyond what original Medicare covers. Finally, the required information, which includes instructions for accessing free language interpreter services, available to answer questions you may have about a plan. If you have additional questions, your sales representative will be available to answer them after the meeting. More than anything, we want to make sure you have the information you need to confidently enroll in the plan that may best fit your needs, your life, and your budget, so you can live a happier, healthier life every day. On behalf of United Healthcare, I'd like to thank you for taking the time to join us today to learn more about your Medicare options. We would be honored to have you as a member, and I wish you the best of health and well-being.